Hey, have you noticed someone close to you feeling unusually low or withdrawn lately? Are you worried that their emotional state might take a serious turn? Depression can quietly appear across many areas of life. Sometimes, your inner emotional weather feels cloudy without you even realizing it. Depression is one of the most common mental health disorders worldwide, but despite how widespread it is, its effects can still be deeply powerful and overwhelming. Soft disclaimer. Before we continue, please note that this video is created for educational and awareness purposes only. It is not intended to diagnose, treat, or replace professional mental health care. Everyone's experience with depression is different, and only trained professionals can provide proper support. If you or someone you know is struggling, reaching out to a mental health professional or a trusted individual is strongly encouraged. Depression and suicidal ideation. Depression can sometimes lead to suicidal thoughts and behaviors. In some cases, the signs of depression may overlap with signs of suicidal ideation, but this isn't always true. A person can experience depression or depressive episodes either with or without suicidal thoughts. So how can you tell the difference between non-suicidal depression and depression that includes suicidal ideation? I explore several signs that may help distinguish between the two. Number 1. Hopelessness and loss of optimism. A study published in the Journal of Affective Disorders reported clear differences between non-suicidal depression and depression associated with suicidal ideation. Two major indicators identified were persistent hopelessness and a lack of optimism. People experiencing these feelings were more likely to fall into the suicidal ideation group, while symptoms like dissatisfaction and low energy were more commonly linked with non-suicidal depression. If you or someone close to you feels deeply hopeless and unable to imagine a better future, rather than simply feeling unmotivated or drained, this may signal suicidal thoughts. Number 2. Previous suicide attempts. Has the person attempted suicide in the past? If so, the risk of another attempt may be higher. This can happen because the brain has previously turned to that behavior during intense emotional distress, especially if the individual is not receiving therapy or professional treatment. This is one of the most significant risk factors mental health experts consider when identifying suicide risk. Number 3. Talking about death or wanting to disappear. Statements about wanting to die, no longer exist, or not be a burden anymore can be serious warning signs. Sometimes, these thoughts appear indirectly through phrases that hint at goodbye or finality. Have they recently been using disturbing or unsettling language about themselves? Research shows that suicidal communication can appear in many forms, such as giving away meaningful belongings, becoming suddenly calm after a long period of depression, or expressing unusual or concerning thoughts. Some individuals may also develop an intense focus on death. According to Suicide Awareness Voices of Education, children may show this through joking or talking about death, increased interest in violence, or repeated themes in drawings, television, or movies. Number 4. Risk-taking or self-harming behaviors. Depression without suicidal ideation is often linked to low energy, making daily tasks feel exhausting. However, this pattern can look very different in people experiencing depression with suicidal ideation. Instead of withdrawal, they may begin engaging in risky behaviors or increase behaviors they were already involved in, such as substance use, dangerous actions, or self-injuring behaviors. If someone appears to place themselves repeatedly in unsafe situations or shows little concern for their own safety, this may be a warning sign of suicidal intent. Number 5. Giving away meaningful possessions. Do they own items that once held strong emotional value? Have they always taken great care of these belongings, but now seem indifferent toward them? When someone becomes suicidal, emotional attachment can weaken. They may feel undeserving of their possessions or believe they won't need them anymore. If you notice a loved one suddenly giving away items that once mattered deeply to them, this could be a sign of suicidal ideation rather than depression alone. Pay close attention to the people around you. If someone frequently talks or jokes about death, listen carefully to what they're saying. Being aware and attentive may help prevent an emergency situation. Not everyone who is depressed is suicidal, and not everyone will show all of these signs. However, if something feels wrong, it's okay to ask and check in. If someone is behaving unpredictably or has harmed themselves, it is crucial to seek immediate professional help. Emergency services and suicide helplines are always available, and resources for several countries are listed below. Remember, no one has to face this alone. Thank you for watching. Please stay safe, and reach out for help if you or someone you know needs support.